Hello, this is Freddie Oliveris, and this is my PowerPoint on Marshfield Clinic Porter Analysis. My Marshfield Clinic Porter Analysis will consist of an organization and mission, clinic services, bargaining power of suppliers, competitive rivalry, bargaining power of buyers, substitute products, threat of entrance, and a conclusion. The first one is organization and mission timeline. In 1916 was when Marshfield Clinic was founded. In 1926, downtown Marshfield was the first clinic building. In 1975, Marshfield Clinic connected to St. Joseph's via a 212,000 new clinic building. In 1984 through 89, there was a completion of additions. In 1980, Marshfield Clinic added another clinic in Colby, Abbotsford, Chippewa Falls, Monic, Park Falls, Phillips, and Mercer. And in the 90s, they had practices with Bryce Lake, Merrill, Wasu, Eau Claire, and other communities were established. The Marshfield mission and organizational statement. The mission of Marshfield Clinic is to provide the highest quality care in all areas of healthcare. Their mission statements include quality of care. Quality of care means receiving the right health care at the right time. Quality medicine. Quality medicine is based on the latest specific research and evidence. Quality of life is an important part of quality health care. Marshfield Clinic services. Marshfield Clinic Health Systems provides over 86 specialties and subspecialties. Marshfield includes a medical research that includes research in the clinical, cancer, epidemiology, and population health, precision medicine and genetics, oral and systematic health, and agricultural safety and health. Marshfield also houses a division of education with resources to define and deliver education to not only our physicians and employees, but also patients. The Marshfield Clinic is a business health solutions service that connects quality health care to the workforce. Marshfield Lab is one of the largest full-service laboratory systems in the nation and a leader in laboratory medicine that was established in 1973. The Porter 5 Forces Analysis. They are the threat of new entry, buyer power, threat of substitution, supplier power, and competitive rivalry in no particular order. The first one will be bargaining power of suppliers. In the Porter method, the analysis of power of suppliers is determined on how easy it is for you to increase their prices. How many potential suppliers do you have? How easy is it for the supplier to increase prices? How unique are the products? And how expensive it would be for the organization to switch from one supplier to another. Some more bargaining power of suppliers. Marshfield categorizes suppliers and their processes to improve the facility supply chain and management. Marshfield researches the discounts available through a GPO. Marshfield strategic cost management is by standardizing supplies throughout the system. Marshall has also signed an integrated delivery network contract, giving them the option to go outside the GPO, allowing them to negotiate for very specific things that are not offered in their GPO network. Competitive rivalry. Companies must attract customers with competitive pricing, remarkable marketing strategies, and quality goods and services. When any organization considers starting a new business or merging two into one, many factors come into play that need to be considered. One is the potential rivalry among existing competitors in the market, the potential of combining leadership or even doing away with some of the positions of leadership. By adding rural hospitals to its network, Marshfield can increase its presence as a major healthcare provider within many communities. Bargaining power of buyers. The definition of bargaining power of buyers refers to the pressure consumers can exert on business to get it to provide higher quality products, better customer service at lower prices. A strategic buyer can make an industry more competitive. Positive experiences will promote a positive perception of the organization, and the patients will voice their experience to others. Due to a large part of patient care expenses not being reimbursed, facilities are tasked with competing for the patient's healthcare needs. Patient satisfaction scores and ratings play a vital part in where a patient chooses to receive their healthcare needs. Factors that affect their decisions are wait times, communications, treatment times, follow-up on education, and facility environment help the patient make their decision. Facilities are tasked with providing excellent care at a discounted price. Substitute products.